Happy Wednesday afternoon. Thank you for being here. Hi, Julie. Hi, Libby. Hi, Vicky. Hi, Naomi. Hi, Kerry. Sam. Hi, Christy. Hi, Jane. Thanks very much. Hi, Linda. Hi, Mary. Hi, Karen. Thanks all of you for coming. While we're just, as we do every week, we'll just give people a few minutes to join. If you would love to pop in the chat where you're joining us from and your role, that would be much appreciated. But yes, thank you for coming to this very important topic today. Who's going to go first in the chat? I'd like just for Anna and Katie's sake, it's so exciting to have people join from all across the country. So if you can tell us where you are, it just makes it even more exciting to be at Webinar Wednesdays. I can see, I feel like I know lots of us now. Karen from Marupna. Oh, from VSK. Oh, thanks for joining us. Libby from Gippsland, Vicky from Yarraman. I don't know where Yarraman in Queensland. Thanks, Vicky. I'm going to Google where you live later. Who else is there? Sam from EPC in Melbourne. Hi, Sam. I can see Jenica there and Andrew from Karuna in Brisbane, Yarrawonga. So we've got people from everywhere. So I think we're 3 past. Let's get going. So welcome everyone to another PCNA webinar Wednesdays. And I think I rebrand the little catchphrase every time we do one, but that was this one today, bit of alliteration. Thank you for being here. We have a topic today that I think is so important, and almost one that I want to share with wider than PCNA, because I think talking with children and adolescents around death and dying um, is so important, and I think as palliative care nurses we have there's a fair bit of content around talking to children who are sick about dying, but I think there's less content about how to support the kids in the circles around the dying person and the adolescents as well. So to talk on that topic, I have brought 2 experts to be with us today. And I'm going to introduce them a bit better a bit later, but then that's Katy. Give us a wave, Katy, and Anna, and I'll give you a bit more information about them later. I'm just going to start with an acknowledgement of country, and then we'll get going. So at PCNA, we acknowledge that we live and we work on the sacred lands of the First Nations people of Australia. Each person today joins us from a different land and a different location, and I'm in Darwin and I am joining you on the lands of the Larrakia people. At PCNA, we recognise and we respect that the sovereignty of these lands was never ceded, and we acknowledge that the air, the waterways and the lands that we work on hold deep significance for the First Nations people of Australia. We honour, we respect and we admire Aboriginal and Torres Strait Islander people who represent the world's oldest continuous culture. We admire their strength and resilience and deep interconnectedness to all living things, and that grounds us at PCNA. So thank you for joining us. We've got 24 people. That's quite a lot. So thank you for joining us on this Wednesday. So I'm going to introduce our 2 speakers. We've got a teacher and a nurse, a teacher and a psychologist and a nurse. But so I'm going to introduce Anna. So Anna Gilkison, give us a wave, Anna. Anna is a person with many hats, can I say? But so Anna has a Bachelor of Music, a Graduate Diploma of Education, and a Master of Counselling. Her clinical interests include communicating, educating, and advocating for young people who are experiencing a time of crisis. And Anna is working within the Australian, how do we say, AYA service at Peter MacCallum Hospital. Is that correct, Anna? I'm sorry, I didn't have that written down.
That's okay. Thanks, Sarah. Katy and I both work for the Victorian Adolescent Young Adult Cancer Service, and we are based at Peter MacCallum Cancer Centre down here in Melbourne. But we are actually a statewide service, and we support any young person 15 through to 25 with a cancer diagnosis or who are coming through our hospital receiving cancer-like treatment.
Cool. Thank you very much, Anna. And Katy, so I think Anna's just let us know where you work, but Katy's worked, she's a nurse practitioner and a clinical nurse consultant also. And she's worked in the pediatric and adolescent oncology services for the last 21 years. She holds a Master of Nursing Practice nurse practitioner and works with Anna at VCCC, we call it now. Is that the correct? Yeah, rather than Peter MacCallum. All right. So both of you, thank you for being here. I think it speaks to the interest that people have in this topic that we've got so many joining us today. So just a bit of housekeeping. If you are there driving your car or sitting doing notes, turn your camera on if you can. Just it makes it easier for us to communicate, thinking that we're speaking to people. Turn your microphone off. And if you have a question about like evolving from what we're talking about, Anna and Katy would really love you to pop it in the chat, and I will feed it to them as we are rolling. So let's get started. So my first question is for Katy. So when we're talking about talking to children and adolescents who have someone in their life that is dying, what do you think are the fundamental principles of communicating with children and adolescents about that dying person? And how does it differ for adolescents?
So I just start by saying that most of my prior experience in this field with palliative care with children, and included in those children with some young people as well, and a slightly older population that was over 18, between sort of 18 to 21 years old. So, but often very much talking to younger children. So I think you've got to take a developmental lens and think about using language that children and young people can understand. Obviously, what I'm going to say to a 15 or 16-year-old about someone in their family who's dying, whether it's a parent or a sibling, is going to be really different than what I would be doing with an under 5 or a 5 to 9-year-old or whatever. So I think I'd be using simple language with younger children, really keeping it simple and keeping it very contained and not having long conversations with that age group, thinking about how much they can concentrate and how much they can sustain concentration. I'd be doing it slowly over time, finding ways to build it into a bit of a story, but not a yarn where we are using fantasy and lots of sort of things around heaven and where, you know, grandma's going to go to this place that little children wouldn't know what that was and how tangible that was. But I think I'd be doing it, if I'm doing it at home, if I was a parent or I was an auntie or I was a friend, I would be doing it gently and at a time, you know, with a developmental lens and at a time that's good. I think it's a normal part of life. I think what we're doing with society these days is trying to protect everybody by not talking about it and not using the right words, the language that we all know. We all know what death and dying is. Young children know just the same as we do, but using all these sort of different words like losing someone or passing, or the children can't really understand that. And I think sometimes we set ourselves up to actually have to undo what we've previously said if we've used a lot of metaphors and we've tried to make it flowery and better than it is, then children just end up confused. I think if I had an adolescent that I was talking to, I would very much I'd be very much responding to questions. They're going to have a lot more questions than younger children, I think. They're going to have more in-depth questions. We're going to have to talk about it in a different way. But I think we do children and young people a disservice if we don't include them, because we kind of send the message that they're not important, and they're not important in this. And whereas it's really important to them that they're, you know, able to grieve in the same way or in their own way around a person, a really loved family member, a parent, or a sibling that's dying.
Yeah, I think that's an important point, isn't it? That actually, in an effort to parents or people in the circle who think that they might be protecting them by keeping them from knowledge, actually does the opposite.
Mm.
And I wonder if you have anything to add to that. And I know Anna has a little one herself, so you know, like that's all we're talking about, all ages here. Anna, is there something from your perspective that you'd like to add to that as well?
I think Katie's been really great and she's hit the nail on the head with a lot of different points there. But from my perspective, I think honesty is the most important part of communicating with children or with young people. And Katie's right, you have to give them this information in a really age appropriate, developmentally appropriate way. And when it comes to the older teenagers, my teaching background for many years has been very firmly in the adolescence period. I've been a secondary school teacher for a very long time, but the acknowledging and appreciating that every young person that you talk to about any topic is going to have their very own unique response. And something I know that comes up a lot when I work with schools and with families and with young people is that you know, it's so important to be sensitive, yes, but like Katie said, just reiterating, you can't be using metaphors. You have to use simple language. And I know that the younger students, or the younger family members, the children will have lots of children are led by curiosity. They have questions. They want to know the hows, the whys. Anyone who's got a 2 to 3 year old will know the why phase. I think that it's really, really important to step back and to borrow a phrase, I think, from a lot of movies, is particularly as a palliative care nurse who's there, who's the expert in the room, is to set the tone. Literally set the tone for the family to have these conversations, is to normalize using, you know, accurate language like dying and death, and, you know, role modeling good conversation with everyone who's there in the room. And absolutely, we need to kind of be flexible, and particularly when working with adolescents, respond to their cues and their questions.
Thanks, Anna. Yeah, I look, and I guess then my follow-on question from that is, say, for people who like me that don't necessarily know, as your parent, you learn what's developmentally appropriate, but you only really do that as you parent along the journey, right? I've only done that as I've gone. But I guess for those that aren't a parent, who's not a parent or was parented a while ago or grandparenting, what's a great source of information to understand what is developmentally appropriate? Can you think of any, is there a resource that we could use, Anna, to understand that?
Absolutely. There's one that I use actually quite frequently. It's actually one that Pediatric Palliative Care Australia have put together, which is actually targeted at teachers, but it provides a really kind of, I think it's like a 3-pager PDF, and it just has really succinct information for supporting families with a loved one dying. So, and how to support the children that might be in your classroom. I think there's a lot of crossover between the resources for the teachers and for the parents as well.
Okay.
Obviously, our work in the oncology sector is quite niche. Not every you know, person is dying from cancer, but there are brilliant resources from Canteen and from the Cancer Council as well around supporting young people in different age ranges to really you know, understand and comprehend information,
All right. Well, we
particularly
might try
around
and
death.
thanks, Anna. We might try and find them and pop them in the well, and Jenica's just said we might try and pop them in the chat. And Jenica's just said there are some families who really object to the word death. Yep, I know that feeling. I was told to then follow the family's chosen language and wording. What do you think? Great question, Jenica. Thank you. Maybe we throw that one to Katie.
Yeah. Look, I just think, I don't know, I always want to respect individual family culture or wider culture in the community. But when I'm talking to young people, I would use my language whenever I can. I think it starts to complicate things if we're talking particularly to younger children around particularly loss and losing. I think it is really tricky. I might be trying to have a gentle conversation that could really confuse children if we are using that kind of language because we're frightened of it. But but always respectful. I think it is tricky. I'm not sure what to say there.
Okay.
Just picking up from Anna, one thing I would say is that when I've witnessed children, you know, that have had honest conversations and they're seeing the grief in other people around them, I think that children are really capable of showing great empathy, being included in conversations, even simple. They often they pick up really clearly when parents are very upset or siblings are very upset, and they can show intense empathy to others. And just by being in the room and witnessing our traditions around death and funerals and all of that, I think it's so important that we include them and let them witness that we are sad as well, and that it's okay to be sad.
Yeah, and we're almost setting the tone for their lifelong association with death and dying, right? Their lifelong feelings about death and dying, how we model the sadness and the culture around death and dying. I think that probably relates nicely to the next question, another question I had, which was if a family member is dying, say a grandma or a granddad, what kinds of behaviours would we expect to see from children and then also adolescents? What's normal? And I might ask Katy. Katy, what are your thoughts?
I think it depends on the relationship that they've got. I mean, if it's a parent, they're likely to be, depending on their age, they're likely to be very much aware that something is happening. Particularly if that person's being cared for at home, they might be seeing deterioration. There's a really big difference with a cancer death, and I've had parents say to me, at least we've had the time. It's not lost on them that they've had a very special time when they've been able to prepare, in comparison to a sudden and unexpected death. So I think it's really context dependent, isn't it? Like if a young child wakes up in the morning and, you know, their parent or their siblings died overnight, suddenly and unexpectedly, that's going to be a really kind of tricky conversation about what's happened, and, you know, that's going to be raw. But I think including children and them watching our behaviours, and they're picking up on the cues and everything, the things that we're doing, and gradually over time having those conversations around that person's impending death and preparing them for that can be really powerful. I think we shouldn't expect children or teenagers to be able to maintain a level of grief that older adults can sometimes display, that it's really normal for children of any age to come in and out of it, and they want to sometimes separate themselves from that grief. They want to have that time with friends if they're teenagers and do normal things like go on a sleepover. They can't be in that state all the time. They often want to get away to be at school. That's their relief. And that's their haven where things are normal, especially when things are really abnormal at home. And I think for young children, they need that. They've got so much energy and inquisitiveness that they just want to be normal the majority of the time, and occasionally you would expect them to display tears or anger or poor behaviour or whatever. They're responding to what's going on in the environment around them. What do you think, Hannah?
I think, yeah, you've picked up exactly what I would have said, Katy, which is, and this is the teacher in me coming out strong here, but this is the, the education and the learning process that we all go through as human beings in, those first 5 years of life. Primarily, all the learning comes from watching what our parents are doing, imitation, play, and, people who have this exposure to death and to witnessing how their mum or their dad or their auntie or uncle or someone that they love and trust, and watching how they grieve really informs their own process and their ability well, initially it's mimicking until they kind of build up that understanding at a later age. But I think in terms of behaviours and responses from children, I think Katie's described them really nicely, but there would also quite often you would see, and I think we appreciate this in lots of different facets of our life, that there would be a period of regression where children become more seeking of comfort, familiar items, support, needing support from their friends and family. And even in teenage years, there's definitely an element of that as well that can present, and that can be quite tricky for people to know how to manage, and they actually can worry a lot of people. It can worry a lot of clinicians too, when they feel like, a 15 or 16-year-old who was formerly very independent all of a sudden, is wanting to stick close to things that make them feel good and safe. And I think that, role modeling of that grieving process and normalizing the language, and just picking up Jenica's question from a little bit earlier, I think really responding to the family's preferences, but still taking that opportunity to teach these children, if you're in the room with them and you've got their attention and they're asking you questions, just very gently kind of building on giving them the information that as an age appropriate way, but also giving that reassurance and comfort to the parents that you're respecting their preferences, their cultural preferences, or any other kind of overlays that might be there.
I actually, something interesting that kind of flows on from Jenica's question and then what both of you were saying. I then wonder what role, say for example, if we're all of us here are palliative care nurses and we've walked into a home and someone, very well-meaning, very worried parents whose mum or dad is dying, and they've got a kid in the vicinity, and they say, tell my kid, can you tell him that Nana's dying? I guess my question for you is, what should that be done as requested, or what? And I guess the flow-on question is, what role does rapport have in that conversation? Do you think that really it should be the person with the relationship that has that conversation?
I'm going to jump in here. I think this is, again, my teaching hat is on. This is all about working out what this child knows first. So assessing their understanding, and that can be done really informally. And just a simple question like, tell me what you think's happening with Nana. Tell me what you know. Is Nana sick? Keeping it really simple and building from there. I would naturally include the parent that's made that request in the conversation. And I think that is probably the best place to start. I would say, fully disclosing that I have never worked as a palliative care nurse, but I have been at the bedside of many, many family members at the end of their life, is that I can absolutely understand how a parent would ask a professional, a nurse, someone with so much authority is not the right word. What's the word I'm looking for? Someone with so much experience. You are the experts in the room at that point in time. There's a pretty good chance that these family members have never witnessed or been present necessarily at a death, particularly one, at home in their own space. So you're the expert. I would lean into that and pull them into the conversation as well.
Thanks, Anna. And Kate, what do you think? Have you got anything to add to that as well?
Yeah, I think, yeah, I agree with Anna. I think it's much kinder and nicer from someone who really knows the child and the relationship that they've got with that family member. And I'd be hoping that we could do it together, and not just feel like we've got to jump in on that day, to kind of take a step back and think, unless this is imminent now, maybe we've got time to do a little bit of preparation and think about how we do that and where that's coming from. I mean, that's just coming from a place of fear, I think, and grief in the person who's asked you to do that. But I think I'd go away and maybe have a conversation with the adult that's asked me to do that, to think about and say, can we just maybe kind of have a chat and see what we think we could do together rather than alone, and just take it from there. Yeah.
I like that, Katie. It's a little bit, it's not dissimilar to the kind of conversations where, as palliative care nurses, you walk into a room or you walk into a space and the loved one says, don't tell them they've got cancer.
Yeah.
Same type of space where you then need to take that person, if you can, delicately take that person aside and say, I totally respect what you're saying to me, but can you tell me a bit more about it? And
I mean, it does come from a place of love. I'll tell you a story. I had a beautiful young man that died in June, July of this year, after a really long cancer illness, with multiple relapses, and I think from a culturally diverse background. And I think importantly, he was diagnosed right on the crux of, he was 17 years and 9 months and started off at the children's in COVID, which I think had a big impact on him and his family as well. And there were so many losses for him. And he died when he was 23 years old. He just turned 23 years old. And his mum and I had a little bit of an up and down relationship at times. I thought it was fine, but there was times where she was pretty cross with me, because we were trying to advocate for a young person as well in that setting. Because, there's a big difference between being just turning 18 and the information you give, and then being 23. And he'd got a lot more choice, and we've gone through ups and downs, and we had a great relationship, him and I. And she'd wag her finger at me and she'd say, don't you dare tell him. Don't you dare tell him. He doesn't need to know all of this. And we got there in the end, and he said to me, I know, but I don't need to talk about it all the time, Katie. And he actually came into hospital in the last probably 10 days of his life, because things were pretty tough at home. And she said, I just couldn't do it. I could not do it, Katie. And I respect that you needed to, but I just couldn't do that to my boy. I didn't want to have those conversations. And we just had this, it was just a beautiful moment where she understood that we came from two different cultures and different perspectives, and we respected each other, but we were different and we had a different approach. And she kind of said, I respect you. And I said, well, I respect you as well. But he absolutely knew he was dying. But it's just that protection, I think, from loved family members that are just trying to do the best they can in that space, and trying not to be too harsh with people, isn't it?
That's a beautiful story, Katie, and I think that's the dance that we do as palliative care nurses, as teachers, is holding that space, right? Just very delicately playing our professional role, which is what you were doing there, but also holding that family member so they don't feel that their loved one is that they don't feel uncomfortable too. So it's a balance, isn't it? And I have a question for Anna, I think. this is going to go to. So I guess, say if we go to a home and there's a child of a parent that is dying, for example, and the people in that circle ask what resources could a school provide to support a child who is dying. What would you say? What advice could these palliative care nurses, or where could the palliative care nurses direct them to support the school to support the child?
I think probably the resource I spoke about a little earlier, the brilliant paediatric palliative care resource for teachers, is really, really helpful. I think something that's important, we've briefly touched on it, but school is a really safe space for many, many young people. Not all, but many. And when I was doing my teaching degree and, all throughout my career, we often talk about children and, play and learning is their business. It's their core business throughout their life, is, all the way through the early years up to the later teenage years. But some of the really helpful resources would be directing them towards specialist services. So depending on where they sit, obviously Very Special Kids is a brilliant program with so many resources. But I think really something, and this is a large part of the role that I do with the AYA service, is around liaising with a school and providing really specialist advice and guidance for that young person or for the family and for that particular set of circumstances. I think the work we do, obviously working with the sick young people, is quite different to working with healthy young people who have parents who are dying, because that is a much more common occurrence than adolescent and young adults with cancer. But really directing families towards their school. There are wellbeing teams within the school who can provide really helpful advice and support. And sometimes it's not about another layer of emotional support that is, so beautifully delivered most of the time by families and by friends, but the practical support around tapping into that community. I think when we think about ourselves as an individual and then as a family and as part of a bigger community, I think we sometimes really forget how much of a big part school and education is a part of the community for these young people whose parents might be dying, hopefully. But the schools are really well supported, set up to be able to support people in a really developmentally appropriate way, because that's their core business. It might sometimes mean that they need a little bit of extra support around the practicalities of the illness or the impact that it may have on the young person. It might be that they would really value a connection with a nurse, with someone who's really well known to the family, who can provide a handover around a bit of a picture where things are at. And maybe even on occasion, I've had plenty of schools ask me this question, for a guide around what does time look like? How much time do we think? When will this person die? Which, as you all know, can be incredibly difficult if ever able to be provided. So in terms of resources, I think tapping into what the school has access to, pulling any specialist team members that might be helpful. I know that, certainly in the paediatric setting, lots and lots of consultants, lots of doctors and nurses like Katy, who's done this work for many years, being able to give that really targeted information to schools can really build their capacity to support the family, which is a really nice way to wrap some extra support around.
So, Anna, would some of the nurses who are joining us will be people who go to people's homes. So if they wanted to, and what I used to do was have a folder full of good information and resources to take into a home to be ready to hand out if it was needed. Where should they go to find that, do you reckon? What type of was it the same resource that we spoke about at the start? That would be, yeah. And
Would be a really good start. I think it's a bit hard to say, Sarah, without being more specific to the circumstances. I think there's so much difference in each circumstance that you need to respond accordingly, I guess, which sounds like a bit of a generic cop-out. But I think personally, and this might be jumping the gun a little bit, you might be asking me a question about this in a little bit, but I feel that as a teacher, there is so much that goes on for a young person, for a student, outside of the classroom, but yet it all has a tendency to come inside the classroom, and we can just read it on their faces. We know, even if we don't know details, we can see when they're struggling. We know when they're having a hard time, and there is just so much support that's out there. But it's sometimes, and I've actually just experienced this week with a school, is communicating with a school who've said, we just don't want to bother anyone, so we won't do anything, we won't reach out, we won't ask questions, because we'll just leave them to it. Don't worry about school. But it is actually such an important part of lives, both with young people with cancer or with a serious illness, but also for those children who, they might be in the midst of experiencing this huge upheaval. They need that place of safety and security.
Yep. And I think you said it well, that actually it doesn't necessarily mean extra layers of support, right? Because schools often already have that close relationship or well-being aspect. It's just maybe as a palliative care nurse, just adding information to that if that's what's needed, and offering that.
Absolutely. Schools are very, very responsive to community services and to all kinds of different providers from all different walks of life offering advice and guidance, because at the end of the day, yes, they're the experts in learning, development, and, keeping young people safe and supported as they grow. But they are so willing to kind of get that expertise in, because at the end of the day, whatever we can do to support a young person whose parent is dying or sibling, they will absolutely take that on board. I've never met a school that's been resistant to, advice or to help or guidance. And even just reiterating the simple things that they already know, like the developmental phrases. Younger kids, they know that they'll have a more basic understanding of the illness, and that they might worry really secretly and quietly that they might catch it and then they might die too. And so being able to kind of have an awareness of what's going on in the background at home, whether that's a really tricky medical picture for one of their parents, is going to support those teachers to be able to better support them in the classroom.
Yeah, and actually, I think my next question kind of flows on to that, Anna. So, and this one's for both of you. Are there any unhelpful phrases that you think just no go, don't say that, please don't ever say this phrase to children when we're talking about death and dying, and any good ones? Anna, you can go. Do you want to have a go, Anna?
Well, I was just going to say, I think we've really touched on this already, but no ambiguity. If you said to a 6-year-old, we're losing, or we've lost Nana, they'd say, did she go to the shops and get like, where's she gone? Will she come back? She'll come back. So I think being really clear is so important. I think, that's the number one thing that pops into my mind, is that no ambiguity as much as possible.
And what do you think, Katie? Is there a go-to phrase that you're like, gosh, just don't say that thing?
Not so much don't say, but do say, like, I do like with younger children, just saying, sometimes when people get very, very sick, they don't get better. We like to think that everyone will get better, but sometimes people don't get better. And I use that with children who are really sick themselves, that sometimes when you're having treatment for cancer, sometimes it makes people better, but sometimes it just doesn't. But I think that, lots of parents have been not really cross with me, but disbelieving of me when I said to them that even very young children can understand the concept of that they are sick and they've not got better for months and months and months, and they actually know that they're getting worse as well. And so I have a beautiful story about a mum who was a teacher herself, and a very intelligent lady and a great dad. They they told me we had a very honest relationship, that the day that I'd said that their 6-year-old would probably have some understanding of what was going on with her, that we needed to be a bit more honest with her through time. We had time to do that. He said, I just sat in that room and thought you were being absolutely ridiculous. But when she was actively dying at home, they could see the distress in her, that she just couldn't settle and she didn't want to go to sleep. And the mum intuitively popped her in bed in the middle of them. And she had a brain tumour. She had a diffuse intrinsic pontine glioma. And her mum started to talk to her about visiting her in her dreams, and that we'll call her Jane. Jane could also have dreams, and she could visit her mum and dad in her dreams as well. So they had this beautiful story about they each knew what was happening, and that when mum went to sleep at night, she would visit Jane in wherever she was and think about her and really be happy thinking about that. And she knew that Jane would be the same, thinking about her mum and dad as well. And she died peacefully in the early hours of the following morning, because she was next to her parents. They'd opened up, they'd realised she needed some information because she knew what was going on, but she was only 6. And she was happy with that. She settled. But parents teach you so much sometimes, their imagination, where they know their child best and they can use words that the child would really respond to.
I love what you said there, Katy, in that story around saying to the parent gently that actually we need to be more honest with your child over time, right? Or it's not let's not harpoon them with the news, right?
You don't need to go in and have one big conversation, but all the time.
Actually, I love that phrase. I think the best approach is to be a bit more honest over time, right? And that gives the parent space to do it in a way that is respectful to the child, but also is kind of planting the seed that actually this is something that we need to do. I love that, Katy.
I don't know about your palliative care nurses that are listening, because I loved the fact that part of my job in my last role was to go out to people's homes, because you get you're in a really privileged position that you get to meet a family that are feeling much more confident and comfortable in their own environment than they would be in hospital. But I've never had very young children ever ask me about, am I going to die? Not those words. I don't know. I mean, it'd be interesting if any of your nurses had experienced that. Much more, the times I've been asked, it's been the relationship and rapport that I've built with a young person, whether they've been a younger, sort of early teenager and beyond, right up to 20 odd years old. We've had open conversations and planning for death, but not with a really young child. I think unlikely that they're going to ask us.
I wonder if there are a few people who are on the chat who are working at VSK.
Yeah.
I'm looking at you, Andrew. I think you're working at VSK. I wondered if anyone who is working at VSK has had a child, ask them directly, and if they've been asked directly, and actually this is getting slightly off topic because we're talking about, we want to talk more not about the sick kids, but if the child who asked you directly had a direct relationship with you, did you know them? I'm going to ask Andrew is that putting you two on the spot? Can you unmute yourself, Andrew? I'll unmute you. Can you unmute yourself, or are you saying no? You can't. Oh, but I think what you're. Oh, there you are.
Worked. So it worked somehow. No, I've never been asked that directly by a child. But those conversations do tend to happen. I think more when there is a strong relationship and some knowledge and trust built between someone and the child.
Thanks, Andrew. And I think that's the point. I think that really is the point, isn't it? That, and even people like Katy, like Andrew, who work with children, sick children around death and dying all the time, actually those questions come out, and you could say that to parents with people that they trust. I have another question. It's related, and I might direct this to Katy. What do you think around if a parent asks, should I bring my kid to see mum or dad who's dying or nana who's dying? What are your recommendations in terms of hospice visits?
Yeah, absolutely. I mean, I work at Very Special Kids as well. It's a beautiful place. It's welcoming of all children, and you know, that's obviously for kids, but I think hospices in general, the palliative care ward here at Peter Mac, just really invites children in and really provides for them in this setting that everybody wants them to be part of it. So we provide toys and space for the young person to come over here, or younger children come over here when they're visiting adults, really encouraging that, you know, even for short periods of time. If there's, you know, recently a friend of mine whose partner was only 34 when he died, and they had a 2-year-old child. That 2-year-old child was front and centre on the palliative care ward and spent time there, but then we'd take him out and up to the cafe or into the space and allow him to play. There was toys provided, because I think we just have to let them be part of it, because like Anna said earlier, that's how they learn. That's how they learn to be from the adults around them. They get that language, they get that understanding, and it becomes part of, you know, just part of society and ritual that children are included. I think when children are excluded, I've been reading some research recently around the exclusion of, you know, older teenagers quite a few years ago. This is, you know, reflections of people that were now in their 50s and 60s that were excluded from any kind of conversation when a parent died suddenly. And one person in the research had had 2 parents die in the space of 6 months. So, and wasn't included in any of that, and was it really isolated that person and really affected how they responded and developmentally as into their early adult life and beyond. And they could vividly recall, I mean, we think that our memory gets worse over time, but had vivid memories of being excluded and wondering what was going on behind those closed doors. And they never had anybody talk to them about it. And they just felt that they weren't important, and that they didn't matter. And I think we don't want children to feel like that. We want children to understand, and giving them the voice and being open with explanations. Those questions will come again and again and again around what happens but why. It's really important.
Yeah. And it's so important, just jumping on what Katy was saying, to really set these children and teenagers up for success in the best way possible. So it's about taking the time again, you know, if they're early primary school age, you know, like I said, they've got that really basic understanding of being sick and illness, and you can read stories about visiting a loved one in hospital. You can look at pictures together of what the hospital might look like, just setting that story in their mind so that they are not frightened, I guess is what I'm trying to say, by this concept of going to see their nana in a hospital. And I think it's also, and this is core to what Katy and I do every day, is stepping back out of our experience and our knowledge and understanding and really centering ourselves in a young person's perspective. And the way that a 5-year-old is going to respond to a situation is so different to a 15-year-old, to a 40-year-old. And our fear, something that we've learned and internalized over many years, is not the same way that this 5 or 6 or 20-year-old or 7-year-old is feeling. this is something that we've developed, and it's about separating yourself from that and really encouraging the parents and the family as much as possible. And you can all do this as nurses to really normalize what they'll see and just explain things that are happening in really appropriate language. You know, you might see that there are lots of tubes, there might be a machine that's beeping. Nana is sleeping at the moment. She's really comfortable. We're keeping her warm, and she just really setting the scene, I think, is so appropriate and so helpful for young people. Always remembering that our fears and anxieties are our own, and these are young people with fresh eyes, and this is our opportunity to help them build their own experience, and it has potential to be a positive one, even within the context of death and dying.
Oh, I love that. I think we need to type exactly what you just said in a little paragraph and put it in the chat, because that little speech there would be wonderful to give to a parent, right? Actually, we've got the opportunity here to have conversations that can set this kid up to find this not a tremendously upsetting experience. And I guess the other thing that I got from what you just said, Anna, was that at schools these days, they do a lot of they do like social stories, if anyone's ever heard that. The same thing, it's where for kids with special, particularly neurodiverse kids, they give you a book about what you're going to see when you come to school. And it's the same thing doing that for little kids. And you're going to go see Nana, and Nana will be in a bed and she might be asleep, but that's okay. Like that type of thing's very helpful for younger children.
Absolutely. And there's so much benefit. I mean, all the learning that particularly the younger primary school age students do, it's through stories and play and drawing, and that's why there is so much benefit and success to music and art and all these kind of wonderful allied health professions that exist within the context of a clinical, and I guess in the community as well. But you can adapt those concepts in your own work, and you can work with families, and just I really feel strongly it's about empowering them to have these hard conversations by, yes, giving them resources, but role modeling and just normalizing.
Yeah, absolutely. And actually, there's a question for Anna in the chat. I'm going to read it out. Is that okay, Andrew? This for Anna. He's curious about anyone's experience, acknowledging that there is a great amount of variance. Do you feel that that wellbeing teams at schools are generally comfortable and resourced for supporting children around death and dying? That's a good question, Anna.
That is such a great question, and you've hit the nail on the head, Andrew. It is so dependent upon what school and what program. For me, the imposter syndrome is real. Trust me, as a teacher working in healthcare, I never quite feel like I've got one foot in either camp. But anyway, the thing that is so clear to me after doing this role for many years is that there is a real disconnect between the healthcare system and education, and they are so similar essentially in how they operate, but yet fundamentally so different. And whilst we are so used to working in healthcare in a multidisciplinary environment, we are calling people in with their expertise. Schools operate on a basis of confidentiality and protection. And we know that cycle of protection, we talk about this all the time, is so hugely beneficial, but can also be really quite disruptive to lots of different things. I think schools, in their heart, at the heart of everything, they are really well set up to support young people, but they can't be experts in everything. And that's where it's so important to get consent from the family and really contact the wellbeing team and give them that advice and guidance, because in my experience, I've never had a school decline my input and my expertise on, for any young person that they work with, or even for, the wider family and community. Look, comfortable is a whole other ball game, because I think, like we've talked about, it all comes down to the individual's experience of death and dying. And we are, I think, inherently as humans, we're terrified of upsetting people and making them feel like worried or sad or afraid at any point. And I think there is the concern from some teachers and wellbeing teams in schools is they don't ever want to open a can of worms that they can't resolve nicely and neatly. And I think talking about death with young people I don't know that it ever will resolve nicely and neatly, but I think it's such a crucial part of life, that it needs to be talked about and normalized. And I think, yeah, the schools would rely heavily on your expertise. And I would say never be afraid of proactively offering it, because they won't often ask thinking that it's not their remit to get involved. But if you go to a school and say, look, you've got John and Jill and their dad is really, really sick. He's at home, he's in their own space, but this is their safe space. Giving them that information, giving them that empowerment to be able to do their job and to provide that safe space, I think kind of goes a long way to bridging that gap between the difference in systems.
Thanks, Anna. I think that's true of my experience too, is that there's great intention there, but not necessarily the resources to take it further. And I think if you're after something like this, you could, it's just perhaps a matter of directing them to some better resources to help them not be afraid of opening the can of worms, as you say, Anna. It doesn't necessarily, it's not neat. It's not meant to be neat. I guess so we have 1 or 2 more minutes, so I'm just going to put it out there. You can put a question in the chat, but I guess what I would like to do, just to reiterate, what was the name? I just want to write it in the chat so that everyone can have it. What was the name of the website, Anna, that you like to use for resources? Because I think that's a nice way to sum it up. Where do we go?
The one I was talking specifically about is released Pediatric Palliative Care. I've got it on my phone here, excuse me. Pediatricpalliativecare.org.au. I'm sure you all know that website. If you just Google Pediatric Pal Care Australia, teachers supporting students at school is probably my number one resource.
Teachers supporting students at school. And that's what it's called. Okay, so you've heard it here, and I'll get James to pop that in our post webinar email. But I'd just like to thank Anna and Katy. I think we probably could have stayed here chatting for another hour. Thank you for your knowledge and for what you bring to this space. I imagine it makes a very, very big difference to many, many young people across Australia. So thank you very much for your time. Just before we finish, have you got anything that you'd like to leave with us as a lasting message, or something you'd like to say just to finish up?
Katy?
There are some really good resources as well. So James is going to pop in the chat as well as send a link about also from a paediatric healthcare perspective. The Royal Children's Hospital did a series of podcasts, and they've done 2 series facilitated by a fantastic journalist that set across the whole spectrum of children with profound developmental needs that are dying, to teenagers and young adults, and then one called 10 Years On. And that is outstandingly good to teach our, sometimes very, very experienced palliative care nurses. It's really great to listen to. There's some really, really great tips about how we can support and help young people with memory making, or children with memory making around grandmas, and things that we can translate from the paediatric setting to parents who are dying. I think those kind of things are really fantastic, and I loved listening to that, and I take stuff from that and I use it around memory making for young people, and if I was dealing with parents, I'd be able to apply it to that as well. But I think something in the paediatric setting that's done really well, that's not really done as well in the adults when parents are dying, I think.
Thank you very much, Katy. And Anna, is there anything that you'd like to leave us with before we finish
Yeah,
up?
I think probably my big takeaway when I'm thinking about young people and children is not to be afraid to talk to them. Don't ever feel as nurses that you've got, that you've got this big disconnect between you and them, because I think a lot of miscommunication, a lot of not involving children and young people in death and dying with their loved ones can be solved with good communication. And that, yes, quite often for the younger kids will involve looping their parents in to support you in that. But I think really getting down on their level and addressing them, talking to them. Don't ever talk over the top of them. I think that's my number one takeaway for adolescents, and it's so applicable in this sphere. I think is that there are there are so many resources and ways for you to upskill yourselves in a particular area. Think of developmental age stage ranges in the same way, and hopefully you will have quite long and beautiful relationships with some of the patients that you work with in the community and within your various facilities, that you'll have a bit of time and effort to be able to put a little bit of effort into looking into how you can better support families and young people alongside the very important work that you all do in the community.
Thank you so much, Anna, and thank you so much, Katy. That really was, for me, it's kind of comforting, right? Just to hear a little bit more about how to gently and with time encourage parents to have these conversations. So thank you very much. And thank you, everyone, for joining us. Lots of thank yous from the chat. We'll see you all in a fortnight's time for another PCNA webinar.